All right, everybody. Hello. We are so glad that you are here today. My name is Joyce Welker. I am a Living Well being coordinator for the Southeast region. Hi, everybody. So today we're going to do a Living Well program overview to make sure that we are able to cover the 2025 program and make sure that we are able to answer some questions that you may have about that program. So as we go, if you have any questions, you cannot take yourself off mute in this program, but you can put it in the questions box. So just remember that. Make sure you use the questions box instead of the chat, and you will be able to get those questions to me, and we can make sure that we cover those at the very end if you have any that I haven't answered as we go. I'm going to go ahead and take myself off camera so that we can make sure that you all get the full view of the slides. I also would love it if someone could just throw a, yep, I can hear you into the questions box just to make sure that you guys are getting the great information that I'm going to share with you today. So if someone doesn't mind just dropping that in there real quick. All right, it looks like you all can hear me, so that is fantastic. Thank you for dropping that in there. I do appreciate that. So today we are going to, like I said, dive into information specifically about the Living Well program for 2025. If you were in this program in 2024, a lot of this will look really familiar, but hopefully we'll be able to provide you with some additional information this year to make sure that you don't miss out on any benefits or any opportunities that the program offers to all of its members. I also want to alert you that there are two handouts in the handout section. So on your management in webinar, if you see that handouts button, there will be two options there that you can click and download. So just keep that in mind as we're going, if you want to download those, you can use that as takeaway information about today's presentation in case you need it. All right, let's dive in here and get started. So first I want to make sure that I introduce the KEHP vendors to you all. So I'm going to give a brief overview of what each of these vendors are. While I'm talking about this is a great screen to take a screenshot of, or also there is a handout under the handout section that has this information in it too. So just remember, this is information you'll probably want to take with you. So to go over these briefly, Anthem is your medical, dental, and vision provider. They offer items like Live Health Online, where you can get virtual support for medical needs and also some behavioral health needs. So keep that in mind and reach out to them if you have additional questions. Hinge Health is in-home physical therapy that is completely virtual. It's 100% free to KEHP members, and they help with all joints from neck to toe, and you do not need a physician referral to be able to utilize them. So make sure you have that in your back pocket as an option to use. Kentucky Deferred Comp is Kentucky's official supplemental retirement plan, and they can help support any of your retirement planning needs. Smart Shopper is a medical transparency company. They help you to shop for the best outpatient care for any type of procedures that you're having done to help save both the KEHP program money and also you money. So if you use Smart Shopper for your offered outpatient medical needs, you will actually get a check in the mail for a portion of the savings. So for example, I've had people tell me that they had to get a MRI done and they used Smart Shopper and they got a check in the mail for $200 because they went to the preferred provider. LARC is a diabetes prevention program. There are some qualifications that you have to meet to participate in LARC. So if you're interested at all in that, reach out to them. They'll ask you some questions to make sure that you're qualified. And they help to support people through diabetes, exercise, and stress management to reduce the risk of diabetes. If you participate in the program, you do get a free Fitbit, and if you you get a free Smart Scale, and if you stay in the program long enough, you can also get a free Fitbit. So lots of good resources there. Health equity is for your health savings accounts. So any information that you need, any questions that you have about those, that is the place to go for those. Castlight, we're going to talk a lot about today because we're really going to dive specifically into the LivingWell program and make sure we answer some questions around that. So we'll bring more to come on that. CVS Caremark is who your prescription coverage is through. So it's who covers your claims. So while you can use any pharmacy, any type of claims that are made will go through CVS. Rethink Care offers support that is specific for parents and guardians of children that need additional support around any type of behavioral or mental care need, especially for all guardians. So keep that in mind that if you are a teacher, a uncle, or a grandparent or a parent of a child that has behavioral needs, Rethink Care is there for you for support to make sure that you feel like you have the information that you need to help support that child. The Personnel Cabinet is who brings the Kentucky Employee Health Plan to you, so they have lots of good information and can answer questions around any of these vendors to you. And then Carum Health is hopefully a vendor that you'll never need, but if you do, it's good to know they're there. They help with support around surgery and cancer treatment. Generally speaking, if you work through Carum Health, there is no cost to a KEHP member around the surgery or cancer treatment. So like I said, again, hopefully you never need their care, but just know that if you do, it's good to reach out to them first so that way you can make sure that your coverage and your care is covered as much as possible. So all these numbers are here. Go ahead and take a screenshot of this. Know that the handout in the handout section is there to provide that information, and hopefully that will get you started on any questions that you have around specifically vendors. All right, let's dive into Castlight. So if you are already on Castlight, then you are good to go. All you have to do is log in. So that's fantastic. You can still log in via the desktop at castlight.com/mybenefits. And you can also still use the same mobile app from previous years, which is Castlight Health. If you are new to Castlight, it's important to remember that it will ask you a company name while you're registering, and you can use KEHP or My Benefits. So if you're already registered, you will not need that information, but it's good to know if you are new, that is something you will need. And then if you have any issues, you can always call a care guide. That 800-681-6758 number, I'm going to put it up on the screen a lot. It was also on the previous one. It's in your handout. I'm going to leave it on the screen at the very end so that you can take screenshots of it. This is your go-to number for any issues that you have. They are a one-stop shop. So even if you have questions about the other vendors that I've talked about today, they can still help support you in finding the answers to those also. All right, so for troubleshooting, keep in mind that Castlight has a forgot password that works pretty efficiently. So as long as you get an email within 24 hours after hitting forgot password, you should be able to directly get into your account if you were not previously able to get in. If after 24 hours you've not received an email or you've not been able to get into your account that you were previously logged into, just go ahead and call a care guide. They will be able to seamlessly see from the back end why you're not able to get that access and how to be able to get you that access. All right, let's talk about the LivingWell program. The LivingWell program is eligible to some capacity to all KEHP members and all state employees. So we'll talk a little bit about what that looks like. First component of the LivingWell program is the LivingWell Promise. So all plan holders who are medically enrolled through KEHP is eligible to complete the LivingWell Promise, and that also includes their spouse. And also, if you are on a cross-reference plan, it means both the employee and the spouse needs to complete the LivingWell Promise to maintain your premium discount. So remember that is that first step that we want to do each year to make sure that we maintain the premium discount for the next year. Next, there's the LivingWell Engagement Rewards. These are these are for plan holders and spouses of medically enrolled plan holders. And we'll talk a little bit more about that here in just a minute. And then finally, we have quarterly sweepstakes. And this includes all KEHP members, whether they're employee or spouse. It includes anyone that has waived a medical program. It includes pre-65 retirees and spouses. So basically everyone, if you can get on Castlight, then you can participate in the sweepstakes and earn rewards. All right, so there's two main components of the LivingWell program in 2025, which is very similar to all previous years. The first one is that you do need to complete the LivingWell promise to maintain your premium discount. You still have from January 1 through July 1 to be able to complete that. So keep in mind, you have 6 months to be able to complete a 10 to 15 minute task, which seems more than reasonable. The problem is it's such an easy task that we put it off for way too long and then we're rushing to try to get it done. So if you're on this call and you haven't completed your LivingWell promise, I encourage you to do it because you can have it done before we even finish the call. And then finally, there's those engagement rewards that we talked about. Those are the opportunities to be able to earn digital gift cards and the sweepstakes. And we'll dive into that a little bit more here in just a minute. All right, for the promise, like I said, you have from now until July 1st to get that completed. To find that in the portal in Castlight, you'll log in, you'll go to rewards, you'll go to ways to earn, and then you'll go to get started. So you see this blue button over here on the right-hand side pointing at get started. That's where you can go to take that health assessment that will satisfy the LivingWell promise. Take about 10 to 15 minutes for most people to get that done. If you are someone who cannot do it this way, maybe you have bad internet service, maybe you're not a tech person and you do not want to do it this way, that's okay. You can complete your health assessment over the phone. You can call a care guide and they will walk through that health assessment with you over the phone to make sure you get that completed. So keep in mind, again, must be completed by July 1st, takes about 10 to 15 minutes, and it all starts at that get started button. Let's say you're logging in and you're like, man, I don't know if I did this already this year. It's been 3 months already in this year. Well, if you can see that 1 of 1 total earned, that means that you have completed the LivingWell promise. If it shows 1 of 1 total earned, you are good to go. If it says 0 of 1, it means you have not done it. So 0 of 1, get that LivingWell promise completed. 1 of 1 means you've done it. If you're like me and you like to cover every step and double check and make sure that everything is completed, go online, look to make sure that you see 1 of 1, and then you can also always call a care guide to have them actually verbally confirm with you that it's completed, and they can make sure that that is completed and that they see that completion on their end also. All right. So now you're all completing your LivingWell promise or double checking to make sure it's done. Once you've done that, you're ready to start earning some rewards. So rewards can be earned from January 1st through December 31st of 2025. And the goal of that is really just to encourage and reward you for all the hard work you're doing to maintain a healthy lifestyle. And anyone that is medically enrolled is eligible to participate in engagement rewards. And anyone that's medically enrolled, their spouse is also eligible to engage. Rewards for medically enrolled members, they can earn up to $200 and their spouses can earn up to $100. And then just remember that any KEHP member, whether you're on a plan or you're waived, you can participate in the sweepstakes. So you can still earn points towards sweepstakes. You just, if you're waived, you don't have the rewards of the $200 and the $100 guaranteed. You can only participate in sweepstakes if you're waived. All right, so LivingWell engagement rewards. You can earn points to redeem those digital gift cards. You can earn points to submit into sweepstakes entries. All the points are 10 points equals $1. So whatever you earn, just remember 10 points equals $1. And remember, you have to claim the rewards by December 31st. They will not roll over. And you can always see your point balance on Castlight, so that way you know, and it changes in real time. So you'll be up to date on what's going on. There's lots of ways to be able to earn. So for this year, if you go get an annual physical, it's worth 1,000 points or $100. So that's a good one to go to. Keep in mind, if you're waived health insurance, you're not eligible specifically for the annual physical, but you're eligible for lots of other ways to earn. Your annual physical, your preventative visits, things like that, your claim will trigger your points. So if within 30 days of your doctor's visit, you haven't seen those points, you need to reach out to Care Guide. Oftentimes what we see happens is if you go get an annual physical, it might not be coded as an annual physical when the claim goes through. So we just need to confirm that it was an annual physical so that way you can get your points, and the Care Guide will walk you through how to do that. Lots of ways that you can continue to earn in the background though, while you're waiting for an annual physical to come around or while you're waiting for your appointments, and we'll go over those also. So you can earn points through your activity, your sleep, and your tracking calories every single day. So there's breakdowns here. So if you earn 5,000 steps, 7,000 steps, or 10,000 steps, you can earn 5, 7, or 10 points. And so if you are using a device or you are manually tracking those, you can earn those points. If you track at least 2 hours of sleep, while we hope you're getting plenty more than 2 hours of sleep, if you track at least 2 hours, then you can get 5 points. And if you track at least 800 calories a day, you can get 10 points. And while, of course, we hope you're eating way more than 800 calories, we recognize that sometimes we forget to track. Sometimes they don't, transfer over, things like that. So the goal is 800 for that 10 points. So in theory, if you are using a device to track these things in your day-to-day life, you could earn up to 25 points every single day, just doing exactly what you're doing, but making sure that your device is speaking to Castlight on a regular basis. All right, so linking a fitness device, this is obviously the easiest way to track any of these things, but not the only. You can always manually track, but it's very easy to connect your device. You just go into Manage Health Trackers, which is under Settings, and you click the device that is yours. You click what it is that you are willing to transfer over, and then you just make sure that they are syncing on a regular basis. And typically speaking, that just means you got to make sure both of the apps are open on a regular basis to make sure that they're speaking to each other. If you have any issues with this, you can do a couple of things. You can visit the Help Center, which you can see that website down there. If you just go to the Castlight website and go to the FAQ Help Center, you can check your tracker compatibility, which is also at the Castlight website, or you can call that Care Guide. And they are ninjas around this, so you can just call them and they can help make sure that they can support to get your device up to date. I always like to remind people, syncing takes time, so if you're connecting a new device, allow for up to 24 hours for all of your information to come in. You can see up to 30 days of historical information come in, but it does take time for all of that to transfer over. So if within 24 hours after you have connected your device, you're not seeing that information, it might be time to reach out to a Care Guide and just make sure everything's properly set up. All right, so when we're logging steps, there is an opportunity to do that manually. I like to remind people of, if you don't wear a tracker, this is obviously a great way to still earn points. But also if you do wear a tracker, but maybe you do things that don't necessarily get you steps, but they get you movement. Maybe you do more strength training. Maybe you like to swim, but you don't wear your tracker. This is a great way to still get points for that activity. You can go in and manually log that, and it will adjust your activity that you're doing into steps. So you can see all of that right in here. You can also create your own challenge within Castlight. And so if you have some coworkers that you want to challenge on getting more steps in, you can go in and create that challenge right here. The only thing to keep in mind is it cannot be created during a time frame that a statewide step challenge is going on, which is in the month of April. So the Trailblazer Step Challenge is currently going on. If you haven't registered, you can still go in and register, and you can still earn points and opportunity to win prizes. So make sure you get in there and do that. And then starting May 1st, you can then create your own challenge again. So it's only from April 1st through April 30th that you're not able to create your own challenge due to the statewide one. You can do healthy habits. These are 7-day trackers where you can set a goal and go in there and make sure that you are meeting your goal, tracking it, getting reminders, and making sure that you're progressing in that area that you're focused on. And then finally, that leads us to those sweepstakes. So a lot of people, the main question is, where do I find the sweepstakes? So if you look on the right hand of the screen, on the little phone, in the middle of the phone, you'll see where it says gift cards and sweepstakes right next to it. When you go to your rewards center, you'll see this as an option. If you are a KEHP member, you will see gift cards and sweepstakes. If you are a waived employee, you will only see sweepstakes. So just keep that in mind that you may have to toggle back and forth depending on whether or not you're medically enrolled. But like I've said, everyone is eligible to participate in those sweepstakes. These are typically bigger ticket items like a $400 Amazon gift card. They change every quarter. They do the drawing at the end of the quarter, and if you are a winner, you'll be outreached to by Castlight so that way you can get your prize. If you are not a winner, they do not reach out, so just know that if you weren't reached out to, then you weren't a winner. And one entry into a sweepstake is worth 10 points. You can enter as many times as you want, so you can sink all of your points into a single sweepstake. You can spread it out over everything that's available, however you want to do that. You just need to make sure, again, you use all of your points by the end of December 31st, so that way they can go towards these. So keep in mind, if you've earned your points to get your $200 in gift cards as a medically enrolled employee, everything after that you earn can easily go into sweepstakes to continue giving you the opportunity to earn rewards. All right, real quick, we're going to go over navigating Castlight, and then we'll go ahead and wrap up for today. So just as a reminder, when you log in, the home page is very user-friendly and basically has everything that you need on it. You will see under your rewards, your progress. So that 0 of 1, 1 of 1, that's what we're looking for. We want to see that 1 of 1 progress when it comes to our health assessment. We'll see our point balance. Then on the right below that, underneath recommendations, these are based off of your health goals that you set when you first set up your Castlight account. So if your health goals have changed, you can always go in and change that, but they're trying to make sure they're providing you with information that's relevant to what you're currently working on. Under your activities, that's where you can see you're tracking the Get Active, Sleep Well, and Eat Smart. Next, we have underneath the health plan, this is where you can access your insurance card. So if you're at the doctor's office and you realize that for some reason you forgot your insurance card, you can now pull that up through Castlight, so you can easily access that. It'll also show you your medical spending, your claims. Keep in mind that these are not real time. So they do have to go through Anthem and then to Castlight. So if you want real time, you will still need to look specifically at your Anthem account, but it does still give you an opportunity to see a quick glance. All right, and then finally, we have this Find Care. So in the Find Care section, this gives you an opportunity to learn more about trusted providers that are under your insurance coverage in your area. Then we have the benefits section where you can learn more about all of your benefits, including the vendors that we talked about here today. We have our notification section, so it will provide different notifications. For example, if you're due for a dental cleaning or anything along those lines, just to help keep you track and manage your health. And that is basically everything. So I promised you I would give you that 800 number again. This is all of the information about care guides. They are your go-to people if you have any questions about your program, your vendors, anything like that. So I would encourage you to take a screenshot of this if you did not download the handout. And remember that if you did download the handout, it is on there in case you need to reach out to a care guide. But I appreciate you all being here so much. I don't see any questions in the questions box, so it sounds like we knocked it out of the park and we got everybody's questions answered. But if you do think of anything that we've covered here, but maybe it brings up a question later on, that is what the care guide is for. So feel free to reach out to them. They'll be able to answer any of those questions. I hope you all have a wonderful day today, and I hope that you go out and really go earn some points today because we've got some sunshine, and earn yourself some points and get some rewards. Thank you so much and have a great day.